TopMedTalk. Monty Mython here. Welcome to this podcast from TopMedTalk in association with Macmillan Trust. If you've been diagnosed with cancer, this series of podcasts, released during the COVID crisis of 2020, will help you think about what you can do to help yourself while you wait for treatment.
Nick Majerison here. Welcome to TopMedTalk. And on today's TopMedTalk, we're talking about the importance of staying active after a cancer diagnosis. We've got two experts with us. We have Sandy Jack, Professor of Prehabilitation Medicine and Consultant Clinician Scientist at the University of Southampton and the University Hospital Southampton NHS Foundation Trust. And also, we're joined by the Professor of Clinical Exercise Science at Edinburgh Napier University and the Director of CAN Rehab, Anna Campbell. Thanks for joining us. So it's important that you remain active after a cancer diagnosis. Anna, do you want to explain a bit about why that's the case?
20 years ago, a fellow nurse asked me, should I be asking my patients to stay in bed and rest and do nothing while they're on their chemotherapy? And when I started researching, I found there was absolutely no evidence. So I started to look at this as a main topic of research to see what happens if you are active after a cancer diagnosis. And the first things we researched was, does it improve your quality of life? And the evidence proves that yes, physically, socially, psychologically, functioning-wise, you feel better as far as your quality of life is concerned. And since then, the research has now shown that there are three main things that really improve when you're active after a cancer diagnosis. The biggest thing is, believe it or not, you reduce your fatigue levels. Now, a lot of people were really amazed that you actually become less tired when you're active, both during and after treatment. The effect that's being active during treatment is kind of like a palliative, a kind of feel-good feeling. And if you stay active once your treatment's over, it's got a very recuperative effect. So there are large trials, clinical trials showing that. And that's a message that we still find difficult to get over, is that really the best thing is that rest is not best, that actually doing some activity will reduce that cancer-related fatigue. So that's the big one.
That is a bit of a surprise, actually, because obviously you assume if you're going to be getting better that the best place to do that is in bed, resting.
Yep. And it's complete opposite. Now, obviously, there's a caveat that if you're right in the middle of treatment, you have to pace yourself. And there will be days, perhaps if you're in the middle of chemotherapy or in the middle of your radiotherapy, that you really are suffering from a lot of tiredness. In those days, you have to listen to your body. But once you feel slightly better, the evidence shows that actually being active will reduce that fatigue. So that was one of the big ones.
So how do people put this into practice then? This is fascinating research.
Well, this is where you actually have to just start to do some activity, incorporate into your day-to-day life, which actually just helps to reduce that cancer-related fatigue. And there are various ways that you can do it, as far as home-based or working with an expert or just doing a little bit of active daily living, depending on where you are in your treatment and, you know, what you like to do depends on what you will do. But any activity at all will reduce that cancer-related fatigue. In fact, it's actually best if you do some aerobic exercise like brisk walking, plus a little bit of muscular strengthening like squats or sit to stand or wall push-ups. If you get the strengthening part as well, that does tend to make people feel less tired. And I think it's because they can still push that door open, they can open that jar, they can still take their bins out, they've got that strength, you know, they've not lost that, which can happen with that cancer-related fatigue if you do absolutely nothing. But the other main areas that it does increase is your cardiorespiratory fitness, which is critical to stop you being breathless or tired when you do anything about the house. And in fact, a colleague of mine who's based in Sloan Kettering in New York, she used to work with astronauts. And she showed that if you do absolutely nothing during your chemotherapy, you actually deteriorate, your cardiorespiratory fitness deteriorates about 10 years. And your muscular strength is like an astronaut who's been in space for 9 months. So you can imagine how much you are deteriorating if you do absolutely nothing during treatment. So if you are active during your treatment, you actually stop or at least reduce that functional decline that can happen. So that's the main three components that really improve when you actually are active after a diagnosis. Your fatigue levels go down, your cardiorespiratory fitness goes up, and your muscular strength, you get stronger and able to do more active daily living. There is some evidence, emerging evidence, that it actually reduces the cancer from coming back. And the reasons that we can say it's emerging is there's no big trials that really prove it. But what they've done is if you follow people who have been active after a cancer diagnosis and compare them to who are inactive, the active people increase their chance of living longer or the cancer not recurring by about 30%. So there does seem to be some evidence that if you're active, it can protect you from cancer recurrence. And there's lots of studies now going on in the labs with animals to show that the tumour shrinks if you're active, and also looking at different markers. And basically, to put it in very simple terms, what I think happens is if you're active after a cancer diagnosis, you strengthen yourself, you are the host of the cancer, and you make your defense mechanisms much stronger. So the chance of the cancer coming back is less. So you boost your immune system, you stop the inflammatory markers, you regulate your insulin better. You have lots of different things that are going on in your body that just help you and reduce the risk of that rogue cell actually developing into another cancer.
So when faced with a cancer diagnosis, there are no real downsides to moderate exercise?
Absolutely not. We've looked at the various things. Now, moderate may be even too much for some people. I would say there's no downside to where you are trying to do a little bit of movement. The main message would be try not to be sedentary, try not to be bed or chair shaped. If you can do any activity, that is great. The more you do, the dose response seems to be better. And that's for the three things that I mentioned, the fatigue, cardiorespiratory fitness and the muscular strength, but also for other side effects like your bone health. For some of the hormone treatments that affect your bone health, the more you can do, you can protect that. But let's not forget the psychological aspects, that really there's strong evidence if you're active, it boosts your confidence to get back to normal. It reduces depression and anxiety, which can be a big, big factor after you've had that diagnosis. So with all these things, it seems to suggest that staying active is good. And the more you do, the more you're going to benefit both physically and psychologically.
Well, listening to this is absolutely fascinating, to be honest. Sandy, what do you make of this? Can you come in here?
Everything Anna's said is supported by the evidence. We've dug a bit deeper to look at why people feel fatigued and very tired, and the outcomes aren't as good after cancer treatments in patients that are less fit. And basically, there is an effect on the batteries in your muscles. So the batteries in your muscles, they're not charged enough, so you actually can't physically do the activities and you get tired a lot more. And really that cancer treatments do harm as well as good. And you need to take that balance. And the dual insult of having cancer treatments and surgery in the context of rehabilitation, then the patients that are less fit have a poorer outcome. There is actual physiological evidence. And we're the first to show in humans that actually in the exercise group, when we looked at this, the tumour shrank more than in the patients that didn't exercise. So it's really emerging that exercise is medicine, have a beneficial effect on the tumour as well as on the patient. So the host tumour interaction is really important. But Anna said it all really.
Sandy, you said something really interesting to me just then. Exercise is medicine.
Yes.
I think of medicine as something you might eat. Do you want to explain a little bit more about that? Is this part of your treatment, actually getting up and doing some exercise and stuff like that? I guess it must be.
Definitely. In the context of rehabilitation, all the leaders in this field, including Franco Carli and Professor Mike Grocott and everybody else, agree that you need to prescribe the dose that is appropriate to how the patient feels. They are having cancer treatments and surgery. So you need to give, if you have a headache, you take a tablet, the dose that will get rid of your headache. If you take a lower dose, you only take one tablet or half a tablet, the effect is not going to be the same. So in all of our work over the past 12 years, we have done personalised prescribed exercise training so that it's the same for every patient at the same intensity. but according to how fit they are. So it's really personalised. And we feel very strongly, hence my title is Prehabilitation Medicine, because this is medicine and it has to be safe. So therefore, it should be prescribed.
And something to add with Sandy is that there are studies that show that if you're active during your doses of chemotherapy, the people who are active manage to get the appropriate dose, just as Sandy said, to give you the best results. But people who are not active tend to have their doses reduced, and therefore they're not getting the appropriate medicine. So again, not only is it a medicine, but it actually really augments the effects of the other appropriate medicines that people with cancer are getting so that the best outcome. And that's critical. When we're talking about being active during cancer, it's at any stage of that cancer journey, from prehab right to advanced. Now, Sandy's done some really, really great research into being active in prehab. And Sandy, you're best to explain what prehab is.
Rehabilitation, the definition we use is it's improving somebody's functional capacity to withstand a stressful event. So it's compared to running a marathon or half a marathon. People that were running marathons train, whereas we expect patients that undergo toxic cancer treatments and major surgery to survive without any preparation. So although we call it prehabilitation, it's across the whole cancer continuum. And when we ask patients, they actually want it to be called the preparedness. They want to be prepared for any of the events along a cancer pathway, whether that's treatment before surgery, after surgery. If they have recurrence, then they'll have further treatment. And it's sort of the golden thread through the cancer continuum is how we describe the prehabilitation.
You don't think that, right, once somebody's had cancer, they finish the treatment, that's it. You really should still be helping them to stay active, change their behaviour long term, so that should the cancer come back, then they're ready to get back into activity again. Because in a lot of times I've worked with clients with advanced inoperable cancer, and they're told there's nothing we can do for you. But when they come for their exercise class, they get hope that, somebody's giving them a better quality of life. They're actually still being cared for so that their quality of life, they may not become fitter, stronger, but they're still able to play with their grandchildren, to go out and do the things that they want to do that makes the later part of their cancer journey as good quality as possible.
This is fascinating. So people who have this diagnosis can actually be an active part of their own treatment by doing exercise, which it seems has moderate exercise, which it seems has pretty much no downsides here. There must be guidelines about this. How does it work? How do people go to the official guidelines on this kind of stuff?
There have been guidelines for, printed by the American College of Sports Medicine, and they're the main ones that set out the guidelines, which I think worldwide we kind of follow in different parameters. So the guidelines, if somebody has finished their treatment, they've got no other complications, they don't have any other comorbidities like heart or diabetes problems, the guidelines are that they should try to do about 150 minutes of moderate intensity. That's just getting slightly out of breath, brisk walking as if you're about late for getting to work. If they did that every week, they would actually be getting the cardiorespiratory health benefits that they would help them reduce these side effects and get the benefits that Sandy and I have talked about. Then you have to incorporate a bit of muscular strength just to keep the muscles and the bones strong. That's the main guidelines there. Now, some people like to push themselves a little bit more, and so you can up the intensity. There's absolutely no problem with that. So rather than doing 150 minutes, you might be a weekend warrior and you decide to blast it for 75 minutes over the Saturday and Sunday on your bike or with Walk for Life or something like that. But if you are in treatment, you would not be able or expected to do that, because when somebody is in the middle of chemoradiotherapy, their tiredness levels and their ability to be active varies from day to day to week. So really, the message during your chemo is, if you can do 10 minutes 3 times a week, brilliant. If you can do 30 minutes 5 times a week, that's even amazing. But listen to your body and make sure that when you're doing your activity, at the end of it, you feel energized, not wiped out. So that's the key messages from that perspective.
Okay, I find this really very interesting because I'm now thinking that you're in a position where you actually can help yourself. You can do some exercise. You can be part of a team. Sandy, I'm fascinated by what you said also, that there's a similarity here between having an operation and maybe running a half marathon or a marathon. It's got me thinking, because of course they're both physically taxing experiences. Having an operation is going to be a taxing experience, as is running a marathon. And it sounds to me like you're suggesting we almost prepare like we might for running a big marathon or something like that. Is that right?
Definitely, that is the advice. But you're right, we, as part of our trials, and we would hope would be our services, that we say to the patients, look, we're your team, we're going to work with you to get you through this, give you the best outcome and support you after your surgery or cancer treatments, because patients do want to go back to doing what they had done before, and we can support them. So there's the MacMillan guidance as well. So Anna and I worked on the MacMillan guidance, which is on the MacMillan website. So that's the guidance and principles for patients undergoing cancer treatments. And also, we are hoping in the fullness of time, with the evidence that's emerging, that this will be business as usual. So there'll be rehabilitation services. So every patient undergoing surgery or cancer treatments will have this preparedness for all the interventions that are part of prehab. So nutrition advice, psychological, emotional support, exercise and behaviour change. We're in a very different environment at the moment, and that's why people like Anna, with the experience of being able to advise patients how to do this at home, is really, really important.
At the moment, we're in the middle of the COVID-19 global pandemic, so a lot of people may be spending a lot of time at home, and of course the consequences of that are going to last for a while, and a lot of people who are listening to us may fall into the vulnerable category, so they're going to be having a little bit of difficulty getting out and about. What do you think maybe we could advise people to do? I mean, I'm wondering, do I get myself a diary maybe to write it down in, or how do I track my progress? Let's put it into a few steps for people.
During this time where you really can't get out and do what you'd normally do, there are, in fact, a lot of community-based programs for people with cancer that are run by Macmillan in normal circumstances. And what they do is they have trained cancer exercise specialists who are able to work with people with cancer, from giving them seated gentle movement exercises to actually giving them really kind of high intensity circuit classes based on what they want to do and their actual fitness levels. But at this stage, obviously, that's not available. So there is actually a Macmillan DVD, which you can download. It's on YouTube. And it's a great little program with seated exercises starting. And it's got 3 levels: seated, moderate, and more advanced. And then it's got an aerobic component, a muscular strength component, and then a little stretch and relax. And I can give you that link so that if you want, you can put it on. So that would be something to do.
All the advice that is being given in this difficult time is very important, but it's really important this is safe. So
yes,
virtual clinics, advice from experts, we absolutely need for some patients. And we haven't really got a true timeline, but we are stating that if people have a firm diagnosis of COVID, a suspicion, or are self-isolating because their partners or family have suspicion or confirmed, they should not do any vigorous exercise at all.
Yep.
This is a whole new territory. So we are advising them not to exercise. We are trying to work with the experts to say how long should this last. The advice is that they self-isolate for 14 days. So we're going to say a minimum of that. And then we would ask Anna's Can Rehab experts to have a consultation with these people and be able to assess what their symptoms and signs are like to see whether it's actually safe for them to exercise.
Anna, Can Rehab, that sounds really interesting. Can you tell me a little bit about that?
Yes, Can Rehab is a training company I set up around about 7 or 8 years ago, because I noticed that when people with cancer went to the gyms and said, oh, by the way, I've got cancer, the shock was there in the instructor's eyes. And a lot of times they were told, sorry, you can't come here because I don't know what you can and can't do. So that's when I realized we need to help the instructors to become much more aware of what they can and can't do with people with cancer. So Can Rehab now trains cancer exercise specialists, and this is a select few of all the instructors who actually now are personal trainers who have qualifications in clinical exercise screening to do with kind of GP referrals. So they're now at a stage where they now could work with very specialist groups like people with cancer. And the great thing about them is they work with these patients and know exactly how to refine and tune the exercise program for their clients so that it's very individualized, it's very safe, and it's very effective. And I've had doctors, GPs, oncologists, surgeons come on the course, and they've said, you know what, we'd be very happy to refer our patients to your guys, because not only do we see that you're doing a safe job, but you're out in the community and you know when to refer back to us. So these can rehab trainers know that if somebody has lymphedema, a swelling in their arm, to refer them back. If somebody starts to have feelings of dizziness, they refer them back. Somebody has a back pain that's just suddenly come on, they refer them back. So the health professionals know that these fitness instructors, the CAN Rehab instructors, are the best ones to work with anybody affected by cancer, particularly during that initial stage when they're either lacking the confidence and really want to know what they can and can't do during treatment stages, or if they're just starting back after a long time.
Right, okay, so this is really important. So at the moment, if it's the case that you have COVID-19 symptoms and you're self-isolating, or you're concerned that your partner has, or whoever you live with has COVID-19 symptoms, it may not be a good idea to exercise, is what we're saying.
Yes, and the reason for that is that, like most viruses, if you exercise when you have a virus, it can cause damage to your heart muscle. And this is called myocarditis.
Right. Okay, so that's a very important note for us at this time.
It absolutely is.
And then if it's the case that that doesn't apply to you and you're isolating, you're following all the procedures, but you have no evidence of a COVID diagnosis, exercise sounds like a really good idea. But at the same time, of course, you don't want to pick up the virus in going out in public and stuff like that. So I'm wondering, what about the group aspect of exercising? Not possible at the moment, but it does seem quite important. Do we have anything to say to that?
Well, I can only comment because from our trials, we've exercised patients in pairs and they love it. They compete with one another. They ring each other up and say, oh, I'm not feeling very well today. And they'll say, no, come on, you must come. I'm going to be there. They'll even ring up if they're not well or have other commitments and try and make a different appointment. So they compete to know how many times they are attending and how well they've done. So they compete for their basically how many sessions they do and how many hills they've been able to achieve. So it definitely is camaraderie, Anna.
Yeah, absolutely. I've found that all the time. The group effect is huge. It really is. From people saying that they feel that these other people know how they feel. They don't have to say anything, but they're in a very secure environment and they know that they don't need to talk about cancer because these other people are very aware and feel exactly the same way. Particularly, I found men who would not be interested in sitting around a table talking about their feelings. You find that they in particular really, when they're in this group, manly environment, they will actually share their worries, their anxieties, their side effects with each other and get the benefits. And in fact, we did a study where we asked women with breast cancer if they wanted to get into a cardiac rehab class or get one-to-one personal training by a fitness instructor. They didn't want the cardiac rehab, so they went for the one-to-one with the personal trainer, but then they asked the personal trainer if you could take them all together. So it just showed that in the long term, they wanted to be people like themselves who understand what they're going through.
How important is it to keep that going during this strange period we're in with the COVID crisis?
It's critical. I mean, for all of us, we're in a very strange environment where our whole routine is gone. But for people who have been diagnosed with cancer, who are either waiting to find out what's happening with their treatments, or who are in the middle of their treatments and used to go to a group exercise class or see their friends for a walk, or even people who've never done any activity but are now being told it is good to exercise, and because I've said that it is beneficial long term, I think it's so important that we support and get as many people diagnosed, living with or beyond a cancer diagnosis, to try and make staying active and, if they can, to exercise very much part of both their cancer care plan or their long-term life plan.
So I'm wondering, if people were part of an exercise group and that's been disrupted by COVID-19, it sounds to me like it's important that they keep those connections going online with people who exercise and make sure that the person in question is exercising and that they're exercising themselves. Am I right?
Absolutely. So this is part of bigger plans for the group that we're working together with Anna and various other experts, to also give people with cancer a connection back to health and care workers. We're not going to put any more pressure on the NHS, but use Anna's Can Rehab personal trainers to do virtual clinics and do consultations. And we really strongly believe, and we know from talking to our patients, even when we've now paused our clinical trial, which was predominantly a community-based exercise training delivered by personal trainers in community gyms, that we've just continued to ring the patients up on a twice-weekly basis just to be able to connect to make sure that they're coping okay. So that connection and the ability to talk to somebody is really key at this time.
Okay, so this sounds like an absolutely fascinating area. It sounds to me like there's new information that people really need to hear, and the bottom line is exercise is good for you. In fact, I'm going to use that turn of phrase that you used before, Sandy. Exercise is real medicine. Thanks for joining us.
Thank you.
Thank you.
TopMedTalk.
Desiree Chappell here. Thanks for listening to TopMedTalk. If you've enjoyed this podcast and you're a medical professional, please check us out at TopMedTalk.com for more information. We bring cutting-edge research right to the ears of lifesavers and carers around the world. TopMedTalk.com for more information.